Hello, thank you for listening. This is the near death experience of Dr. Robert Cole. And the date on this experience is unknown, but it was documented on January 27th of 2018, open quote. At first, it was the light, a brilliant white light without reflection and without glare. Then, the feeling of quiet jubilation, of peace, and incredible serenity enveloping me. It was not ecstasy or any feeling I could identify, except perhaps glory in the warmest, most positive sense of the word. It was not at all similar to what I had experienced as an Air Force medical officer taking the USAF psychological training program on the 5th of May, 1960, at Lackland Air Force Base for flight officers and deliberately hyperventilating to see how that felt. And then later, deliberately taking off my oxygen mask at a simulated flight chamber, low oxygen, high altitude, around 20,000 feet, and experiencing the exhilaration of mild hypoxia, as well as the other symptoms which occur physiologically during hypoxia, and learning how to differentiate hyperventilation from hypoxia, which is obviously important if you are flying at high altitudes or landing a plane. During this time of jubilation and peace and serenity, I heard nothing, felt nothing, smelled nothing, and had no sense of pain and no sense of having a physical being. I did have the feeling that I was conversing with God, and that I was being given important insights and facts about the nature of our being and the reasons for our existence that I must not forget and which I must communicate to others because of their incredible importance. I was given the impression that there is a God, a loving God, and that it was the same God for all people. There was more. I know that was communicated, but I have little memory of anything specific. I do remember that somehow it was conveyed to me that it was not my time yet, and I had to return, that there was more for me to be, and this was differentiated from anything I had to do. I then started hearing very loud and unpleasant sounds of paper ripping. In retrospect, possibly the sterile envelopes of gauze pads, and then voices, men and women, speaking in low murmurs, and then a voice saying, "It's almost time for lunch," and then another saying, "He's had a respiratory arrest." I was still not feeling any pain and not seeing anything at all. The white light had vanished. I awakened some time later in a hospital bed in the BW hospital on the neurosurgery critical care unit with tracheostomy in place, my arms and legs tied to a bed, IV tubes in place, as well as urinary catheter, and hearing the sounds of a busy critical care unit. I knew I had a respiratory arrest, but I didn't know why or when. The last I remember was going into the hospital for a C2, C7 lumpectomy and fusion to repair damage of a skiing accident in March 1968 at Killington Mountain in Vermont, which had intermittently caused me pain, but had recently been causing problems using my right arm. So I thought it was probably prudent to finally have the surgery which had long ago been recommended. I remembered the pre-op procedure prior to the intubation. I was told, much later, that I had been walking down the hall with a nurse the day after successful lumpectomy and fusion and uneventful extubation, and that I suddenly slumped to the floor, unable to breathe. Fortunately, a neurosurgeon was in the next room, performed an emergency cricothyroidotomy on me because I could not be intubated while unconscious. My throat had swollen greatly after being extubated the day before. I have since obtained the hospital records, which showed indeed that at 10:30 a.m. on that date I had a respiratory arrest, that my P oxygen had fallen to 60%, but rose quickly to normal once I was tracheotomized. I do not know the precise length of time between my respiratory arrest and the successful placing of the tracheostomy, but do know that normal intubation was attempted and was unsuccessful. I told no one initially what I had experienced. I could not have spoken anyway with the tracheostomy tube in place. I had trouble conveying any of my thoughts meaningfully at first until a thoughtful student nurse provided me with a pad of paper and a pencil, for which I was extremely grateful. I still vividly remember her breaking into tears when I told her how much I appreciated her thoughtfulness. My recuperation was slow, and I spent about 4 weeks in the hospital and then 4 weeks in a rehab hospital. While in the hospital ICU, I attempted to check myself out to see if indeed my experience, which I recalled immediately, was because I was brain damage secondary to hypoxia. I am a physician with formal training in neurology and psychiatry. I remember that my thinking initially was confused, that I could not remember the last 6 presidents or subtract 7 from 100 or spell world backwards. Finally, however, I had the wits to ask what pills they were giving me and realized I had the right to refuse the haloperidol and other sedating pills they were giving me. Soon, I was able to remember the past 6 presidents, to subtract 7s from 100, spell world backwards, and I did not feel I was hearing or seeing things that were not actually there, but I remained reluctant to share my experience until I was safely home. Even then, I was reluctant to share my experience except with those I trusted, and whom I trusted would tell me if what I was saying seemed psychotic or brain damaged, or if I was behaving in a peculiar manner. Since my white light experience, or near-death experience, I have read accounts of many hundreds of reported near-death experiences and subscribed to the monthly Journal of Near-Death Studies, which tries very hard to be even-handed in its editorial approach. I have read many of the writings of Elizabeth Kubler-Ross, Kenneth Ring, Michael Sabin, Gary Zukov, Kimberly Clark Sharp, and many others, with the more recent research by Bruce Grayson, Melvin Morse, Sam Parnia, and Peter Fenwick. But the evidence-based medical literature is sparse, although currently increasing in scope. What I have gleaned from what I have read is that many others have had experiences quite similar to mine, and that experiences seem to cross religious, social, and cultural barriers, but their expression does seem to be affected by previous religious and cultural backgrounds. Many people seem to come out of the experience with more belief in God, but perhaps less in formal religion, although I found no studies quantifying this. Children seem to have a pure experience with fewer cultural overtones. Some adults do have experiences that link them to a significant religious figure or deity that corresponds precisely to their prior religious upbringing. Some people who try unsuccessfully to commit suicide are reported to have had nightmarish near-death experiences. Since my surgical recovery, I have resumed practice as a psychiatrist and now include, as part of my history, taking a few non-directive questions regarding any unusual experiences people might have had during an accident or a surgical procedure. I've also have had 2 patients spontaneously report to me what they had previously told no one and wrote out reports for me that are variants of my own experience, but they had said nothing previously for fear of being called crazy. Neither patient was being treated by me for a psychotic illness. Was my experience secondary to a flooding of my temporal lobe or God spot activated by ketamines, a potentially hallucinogenic chemical, as some suggest? The cross-cultural nature of the experiences confuses rather than clarify. Some cultures see caves, others tunnels of light. Could it indeed have been secondary to hypoxia? My own experience with hypoxia in a tightly controlled environment in the Air Force was not in any way comparable to the feelings I experienced while seeing the light. Was it some sort of consciousness alteration mediated by subatomic particles in the brain that respond to the laws of quantum mechanics rather than cellular and molecular biology? I have been reading the most recent works by Christoph Koch and other eminent neuroscientists who are trying to localize the sites in the brain for consciousness, with the prefrontal cortex currently the most likely suspect. But will this lead to a single neuron or set of neurons or to specific molecular neurotransmitters? Or will the particle size continue to shrink and be elusive until technology improves by orders of magnitude? Just as there are currently string theories involving the cosmos, about which reputable scientists theorize, could there be microtubules or fields of energy that envelop each of us and in which our spirit resides when we physically die, even if the death is brief, as in the near-death experiences? Or, leaving the most imponderable for last, was it a true religious experience, proving the existence of God? There are currently teams of reputable scientists working on improving experimental design and increasing the scope and validity of reporting. There are groups such as IANDS attempting to educate and inform and to sponsor true scientific research in an area where much that is written seems to be the stuff of folklore and wish fulfillment. Some experiencers report the acquisition of various superpowers and write books which sell very well in today's religious pop psychology market. I, somewhat sadly, must report that I have not acquired any new powers or capabilities, and recent research studies seem to validate that such claims cannot be validated, despite the many anecdotal reports and books on the lecture circuit. I look forward to reviewing the results of the current teams of scientists and to the increasingly sophisticated questions which they will raise. I have just become aware of a study by scientists at the University of Chicago, soon to be published in the Journal of General Internal Medicine, finding that most U.S. doctors believe in God and in an afterlife. 76% of 1,004 physicians surveyed said they believe in God, and 59% believed in some form of afterlife. My own belief prior to my respiratory arrest/NDE included believing in God, but with a strong conviction that the way to demonstrate this was to be helpful to my fellow man while alive, and with no feeling that I would be rewarded in an afterlife for my deeds, for I did not believe in an afterlife. Somehow, after my respiratory arrest/NDE, I awakened with the firm conviction that there is a God, a gentle, forgiving God, and the same God for all of mankind. Was I so terrified by my close encounter with death that I mentally had to configure this strong conviction? I certainly have no memories of anything frightening during my experience. My awakening and subsequent slow recovery were distinctly unpleasant, but I am perplexed by my subsequent total conviction of God's existence. As a scientist, am I therefore to disqualify myself from evaluating current research for fear of falling into the scientific trap of the immaculate perception and accepting as truth only that which goes along with my personal belief? I hope I have been well enough trained in the scientific method and the currently taught evidence-based medicine to separate belief, no matter how strong, from truth, however it is demonstrated. Many years passed, and with the passage of time, I occasionally wondered when or if I was going to acquire those superpowers written about by some experiencers. One of my other sons recently, in a conversation with me, brought up the past, saying, "Dad, remember that white light experience telling you there was something you had to be? You had to be a grandfather." And so it was. End quote. Any questions? Robert? Thank you very much for your story and your questions and that you raise. They're all valid questions, and you can see there's some wrestling going on somewhere there. Must be difficult to know for a firm conviction that there is a God and then possibly try to forget that when you're talking and reading about other things. I don't know. Sometimes I think we probably do that here, listening to these NDEs. If we believe a certain way and there's an NDE that says this different way, do we suspend what we know to be fact to realistically and fairly determine or evaluate what we're hearing, even though it doesn't conform exactly to what we know to be true? It's definitely something that I deal with sometimes here reading these, and possibly you do as well listening to them. Appreciate you. That's how we learn too, right? I hope you have a great day. Thank you.